The U.S. Embassy is hosting today's program to reconsider disaster preparedness and response, focusing specifically on the inclusion of people with disabilities. Before we begin, I'd like to remind everyone that today's program is on the record and will be recorded. There will be English and Japanese simultaneous interpretation, as well as Japanese Sign Language interpretation. Captioning for today's program is available through the UDTalk app or in your web browser directly. Instructions for connecting were sent out prior to today's event and can also be found in the chat box shortly. Following the opening remarks and presentations, we will open up the session for question and answers. We invite you to submit your questions throughout the session in the Q&A box. You can submit them anonymously. Additionally, during today's program, we will be conducting audience polling, and we encourage you to participate. It will be completely anonymous. So now I would like to invite you all to engage with us in some of that audience polling. This helps us to better understand who is in the audience with us today and to get your thoughts on today's topic. So the polling questions should pop up on your screen now. So please take a few minutes to answer them. Again, your answers are completely anonymous. We do have 4 questions. So the first question is, have you ever heard of the Federal Emergency Management Agency, known as Fema, before? The second question is, does your city or town have an emergency response plan? The third question is, does your city or town have a special assistance program for persons with disabilities for emergencies or disasters? And the fourth question is, do you think the current emergency management plan in your city or town is sufficient? We're getting some answers in now. We'll give you a few more moments to go ahead and submit your answer. Again, they're anonymous, no wrong answers. A few more moments here. Okay, I'm going to go ahead and end our polling and be able to share the results with all of you. All right, you should see them on your screen now as well. So for question 1, most of you actually haven't heard of Fema before. So we are even more excited to be hosting Linda with us today to explain a little bit more about what the Federal Emergency Management Agency is and what role they play in U.S. disaster response. And looking at whether your city or town has an emergency response plan, most say yes, but some say I don't know. So I think this will be a great time to start thinking about that and wondering where we can get those resources from our local officials. The third question, it looks like many don't know if there are specific assistance programs for people with disabilities during emergencies or disasters. So we'll, again, of course, talk more about that today. And some, I think, unfortunately, many feel that the plans in place are currently insufficient or don't know about the plan enough to decide whether it's sufficient or not. So I, again, hope that this is a time for us to reconsider and think about emergency and disaster preparedness at all levels where we are. So thank you all so much for participating in our audience poll. So without further ado, I would like to introduce the moderator for today's program, Professor Kitagawa. Professor Kitagawa is currently a professor of social welfare at Seitoku University. She is also professor at Shotoku University and professor emeritus at Saga University. Prior to these positions, she was the deputy director of the Support Office for Female Researchers, and director of the Gender Equality Office at Saga University. Professor Kitagawa has been a visiting researcher or instructor in South Korea, Nepal, Taiwan, and China on topics including urban disaster prevention and welfare. In 2015, she received the Mongolian Academy of Education's Excellent Female Researcher Award. And in 2016, she received the Japan Society of Female Scientists Distinguished Service Award, as well as the Saga Prefecture's Political Merit Award. So with that, I would now like to turn it over to Professor Kitagawa. Kitagawa-sensei.
Good morning, ladies and gentlemen from Japan, and a good evening to those of you from America. My name is Keiko Kitagawa from Seitoku University. I will be your moderator today. I specialize in social welfare, and I have been conducting research for many years on the theme of disaster prevention and mitigation measures for people who need assistance in times of disaster from the standpoint of welfare. Last year, the U.S. Embassy in Tokyo hosted a commemorative lecture on the political participation of people with disabilities in commemoration of the Americans with Disabilities Act, or ADA, celebrating its 30th anniversary in 2020. This year marks the 10th anniversary of the Great East Japan earthquake, and that is why we're having this lecture today. We're very grateful for this. In Japan, our crisis management measures are undergoing a full review so that we are well prepared to mitigate disasters in the future. I also am reminded of the fact that 24,000 US troops from Operation Tomodachi provided support at the time of the Great Eastern Japan earthquake, and we are very grateful for that. We would like to welcome Director Ms. Linda Mastandrea from Federal Emergency Management Agency, or Fema, who oversees crisis management for people with disabilities in times of disaster, to speak about emergency preparedness, understanding accessibility needs, about collaboration between Fema, local governments, and communities, and how they provide information to people with disabilities in times of emergency. Since last year, COVID-19 became one of the integral part of the disaster management measures. In Japan, we have a long history where people suffered from various infectious diseases and disasters since ancient times, but this is also the history of social work and social welfare. Japan is a disaster-prone country, but we need to come up with measures to become a leader in preventing disasters. I would like to express my sincere gratitude to the U.S. Embassy for organizing this lecture and for inviting an expert from Fema, where we have always learned how to respond to disasters. Now, I would like to introduce today's speaker, Ms. Linda Mastandrea. She's the Office of Administrator and Director of the Office of Disability Integration and Coordination at the Federal Emergency Management Agency. The Office of Disability Integration and Coordination, or ODIC, aims to address community-wide crisis management by integrating people with disabilities in all aspects of disaster preparedness, response, recovery, and mitigation. Ms. Mastandrea is committed to achieving FEMA's policy of leaving no one behind, which represents true inclusion of people with disabilities in all aspects of crisis management. In particular, Ms. Mastandrea has spent most of her career as an attorney specializing in disability and civil rights law, dealing with disability, discrimination in employment, housing, public accommodation, and government services. Also, Ms. Mastandrea has another wonderful career. From 1990 to 1999, over those 10 years, Ms. Mastandrea represented the United States 7 times in wheelchair track in international competition, including 2 Paralympic Games, winning 15 gold medals and 5 silver medals. She sets national, world, and Paralympic records numerous times. This is quite marvelous. Ms. Mastandrea is the first female Paralympian inducted into both the Chicagoland Sports Hall of Fame and the National Italian American Sports Hall of Fame. I expect she may share with us her experience at the Paralympics as well today. Ms. Mastandrea served as chairperson of the International Paralympic Committee Legal and Ethics Committee. Her book, Sports and the Physically Challenged, an encyclopedia of people, events, and organizations, was published in 2006. Ms. Mastandrea earned her BA from the University of Illinois and her JD from Chicago Canton College of Law. Now let us now ask her to begin her presentation on emergency preparedness, understanding accessibility needs. I am also very excited to hear her talk with you all. After her presentation, as Ms. Kelsey mentioned earlier, we have some time to take questions from the audience. Now with that, I would like to hand over to Ms. Mastandrea.
Good morning, and thank you, Professor Kitagawa. Thank you to the United States Embassy in Tokyo and to the United States State Department for the opportunity to be here with you this morning. Before I begin, I'd like to commend and thank the United States Embassy in Tokyo for its year-long campaign to mark the 30th anniversary of the Americans with Disabilities Act and for including the work of our office in that outreach. Over the past 30 years, the ADA has ensured improved access for people with disabilities to the workforce, to buildings, to doctors' offices, museums, restaurants, shops, recreational areas, government facilities, and so much more. It has also ensured that our cities and towns, as they are built and rebuilt after disasters, are planning for the needs of people with disabilities living in and visiting their communities. It has also played a vital role in ensuring that the needs of people with disabilities impacted by disasters across the United States are met. Today, I'm going to give you an introduction to Fema, to the Office of Disability Integration and Coordination, and the work that we do. I'm going to share with you how we work with other federal agencies to ensure people with disabilities have access to the programs and services of our federal government, and how that interagency collaboration is necessary to stage successful and safe events like the upcoming Paralympic Games. Then we're going to talk about ways FEMA helps people with disabilities prepare for disasters. And finally, we'll examine FEMA's role in the United States response to the COVID-19 pandemic and vaccine mission. And after that, I'll look forward to taking your questions. So with that, let's begin. Next slide, please. Next slide, please. So first, an overview of FEMA, or the Federal Emergency Management Agency. Since 1979, the Federal Emergency Management Agency, or FEMA, has been the United States government's lead agency in responding to and recovering from our nation's largest disasters. After the events of 9/11, FEMA became an essential component of the newly organized Department of Homeland Security. FEMA has a very important mission in the United States. It is helping people before, during, and after disasters. And FEMA's philosophy is that disasters are best managed when response is locally executed, state managed, and federally supported. And everything we do flows from that philosophy. At FEMA, we employ more than 20,000 people nationwide. Headquartered in Washington, D.C., we have 10 regional offices located across the country. Each federal region consists of multiple U.S. states, territories, and tribal nations, and each has its own regional leadership. We leverage a tremendous capacity to coordinate within the federal government to make sure the United States is equipped to prepare for and respond to disasters. Our strategic focus is on building a culture of preparedness, readying the nation for catastrophic disaster, and reducing the complexity of FEMA. Next slide, please. So FEMA's Office of Disability Integration and Coordination also has a very important role and a very important part of FEMA's mission. At the Office of Disability Integration and Coordination, we help people with disabilities before, during, and after disasters. Our goal is to create a world in which the self-determination of people with disabilities is respected in all aspects of public life, and that people with disabilities are engaged in the development of policies, programs, and the design of public facilities. Next slide, please. So I want to tell you a little bit about ODIC and what we do and how we do it and why. So after Hurricane Katrina in 2005, the Post-Katrina Emergency Management Reform Act, that's a mouthful, created the position of Disability Coordinator to advise the FEMA administrator on all issues facing people with disabilities in disasters. And then a few years after that position was created, the Office of Disability Integration and Coordination, or ODIC, was created to support that individual. So ODIC works to ensure that all of FEMA's programs, services, policies, and procedures serve the needs of people with disabilities. ODIC provides advice and guidance, training, and resources to FEMA staff to build the capacity of all of FEMA's programs to serve people with disabilities in an accessible, integrated, and effective way. We help FEMA to proactively design programs, services, policies, and procedures to include the needs of people with disabilities from the start, before disasters happen, so that we're not just reacting to barriers that are identified during response and recovery. We're also actively engaged in education, outreach, stakeholder engagement. We hold monthly disability stakeholder calls on a variety of topics. For example, we've addressed the COVID-19 response and vaccine center mission, we've addressed FEMA's funeral assistance program, crisis counseling, the disaster distress helpline, how FEMA works with tribal nations to make sure their needs are served, and many other topics as well. Next slide, please. Additionally, ODIC provides support during major disasters and emergencies declared under the Stafford Act in what's known as FEMA's National Response Coordination Center, where all federally declared disaster response is coordinated, making sure, again, that we are meeting the needs of disaster survivors with disabilities through engaging with all of the programs and services FEMA provides, through engaging with all the federal interagency partners who are serving people in that disaster to make sure that the needs of people with disabilities who've been impacted by that disaster are effectively met. Next slide, please. So we can't do it alone. It takes regional, state, and local coordination to effectively serve people with disabilities before, during, and after disasters. And in each of the federal regions, we have regional disability integration specialists who work on things like stakeholder engagement, capacity building. They provide training to disability stakeholders on preparedness. They provide technical assistance to emergency managers on integrating the needs of people with disabilities into their community's emergency preparedness, response, and recovery plans. And they facilitate the creation of advisory groups that bring together disability stakeholders and emergency managers and other public officials so that together they can more effectively meet the needs of people with disabilities before, during, and after disasters. These regional disability integration specialists serve as key advisors during every federally declared disaster. They provide situational awareness and data on the impacted population of people with disabilities to allow for more effective and accessible services for those disaster survivors. We also have disability integration advisors who deploy to active disasters to ensure that the needs of people with disabilities impacted by those disasters are met. The Disability Integration Advisor works with the FEMA program offices to do things like make sure disaster survivors with disabilities can register for and receive FEMA assistance. They facilitate the provision of American Sign Language interpretation for housing inspections and other services. They train disaster survivor assistance crews on effective communication with people with disabilities. They provide individual assistance staff with information on how to meet the unmet needs of disaster survivors with disabilities. And they facilitate the provision of large print and Braille materials to be provided to people with visual disabilities who need them. So FEMA is very much about data-driven decision-making. And to facilitate that, we have a tool called the Disability Dashboard. This provides field leadership in a disaster with census data on people with disabilities in a disaster-affected community, together with the numbers of people with disabilities who've registered for assistance in that disaster, which allows a snapshot of how effective we're being in reaching the disability community in that impacted area, and allows us to create and implement better and more targeted outreach and improve services to those impacted people with disabilities. In addition to developing and providing training on things like integrating the needs of people with disabilities into FEMA programs and services and accessible communication, we're also in the middle of developing a course to train emergency managers and others around the nation on how to improve their emergency operations plans, identifying ways to integrate the needs of people with disabilities throughout those plans, again, resulting in improved services and better outcomes for people with disabilities who've been impacted by disasters. So ultimately, the goal of the Office of Disability Integration and Coordination is to help all of FEMA, and in fact, all of the emergency management community, provide the best service to people with disabilities who've been impacted by disasters. Next slide, please. So no matter how skilled and dedicated we are, though, like I said, we can't do it alone. FEMA is one agency, right? And my office is one office. In fact, what it really takes is an extensive network of federal interagency coordination to facilitate this effective disaster response for people both with and without disabilities. So just to give you a little bit of a taste for who's involved in disaster response across the United States, aside from FEMA, we have the Department of Defense. They provide support through the provision of people and supplies to do everything from flying generators to the Virgin Islands, to debris clearance in Oklahoma, to running temporary camps for earthquake survivors in Puerto Rico. The Small Business Administration coordinates disaster loan administration for individuals and families as well as businesses to get them back on their feet after a disaster. The Department of Labor facilitates disaster unemployment assistance to provide help to people who've lost their jobs due to a disaster. The Housing and Urban Development Department plays a role in post-disaster housing reconstruction as well. And this is just a few examples of the many, many agencies that play an important part in disaster response and recovery across the United States. And most recently in the US, the new administration appointed a director of disability policy at the White House. And she facilitates an interagency working group on disability to coordinate efforts across the many federal agencies that play a role in serving people with disabilities. And ODIC is proud to be a member of that group. And we're also engaged with the Centers for Disease Control and Prevention, or CDC, Health and Human Services, or HHS, we like our acronyms, and providing education, outreach, technical assistance, and guidance in regards to the COVID-19 pandemic response, again, to make sure that the needs of people with disabilities are met. Next slide, please. So a few moments ago, I mentioned the work of the regional disability integration specialists and their engagement with disability stakeholders and emergency managers and the importance of that relationship. And each of these regional disability integration specialists serves a multi-state area with hundreds, if not thousands, of disability organizations, emergency management agencies, and other governmental and non-governmental entities engaged in disaster preparedness, response, and recovery. So cultivating these relationships with all of these various entities and organizations is key to the success of disaster preparedness, response, and recovery for people with disabilities across the United States. Through engaging with disability organizations, the regional disability integration specialists better understand the needs of people with disabilities in the local communities, and they can also facilitate connection with the emergency managers and other government officials in that area to ensure that the people with disabilities in that community are engaged in planning and preparedness and exercise and training opportunities at every level. And as a result of this relationship building, many disability organizations and emergency managers have come together to participate in community advisory groups that facilitate accessible and inclusive emergency preparedness, response, and recovery across the nation. And this is really exciting because that's where the real work can happen, when emergency managers and people with disabilities get together long before a disaster happens, and they can identify needs and together come up with solutions to meet those needs. That's where really the magic happens. And I think in Japan, this kind of engagement might be facilitated at your prefecture level. I think that's kind of the most logical place for it that I can see. And there it would make sense to engage disability organizations with your government offices responsible for emergency and disaster preparedness and response. And there you might be able to gain valuable knowledge from these stakeholder organizations to identify the needs of the community and together make plans to meet those needs. Engaging people with disabilities and disability organizations in preparedness planning, in exercises, in information sharing helps our state emergency managers to reach more people with disabilities with life-saving information. It helps to identify technology. It helps to identify transportation and other opportunities, and to identify, quite frankly, other challenges in the community where people with disabilities live and work. But again, it's in that getting together and sitting down and having these conversations where solutions can be identified and plans can be implemented to solve these challenges. So I'm very much aware that Japan is a world leader in disaster preparedness. Your country has probably the most sophisticated early warning earthquake system. Your tsunami warning service monitors seismic activity 24 hours a day, 7 days a week. And I know that tsunami safety has been a focus of coastal city planning throughout your nation. Building on that kind of success to integrate the needs of people with disabilities across your emergency and disaster preparedness, response and recovery efforts would only serve to strengthen Japan's capacity to serve all its people, including those with disabilities during disasters. Next slide, please. So we've talked a lot about coordination at the federal level, at the state level, at the local level, and how important that is to ensure that the needs of people with disabilities are integrated into emergency and disaster preparedness, response, and recovery. And this collaboration and coordination is absolutely essential to the effective staging of large-scale events like this summer's Olympic and Paralympic Games, which I'm sure is on all of your minds as the days are counting down and the games are drawing closer. As a Paralympian myself, as well as the former chair of the International Paralympic Committee's Legal and Ethics Committee, I understand the unique challenges that arise with bringing thousands and thousands of people with disabilities, support staff, coaches, family, and friends into a country and adding to the already existing population of people with disabilities. But I also understand the powerful catalyst the games can be for bringing about positive change, like improving accessibility and inclusion for people with disabilities. And I know that the Olympic and Paralympic Games present many challenges in the best of times. And I know that they are presenting many challenges in particular this year. These challenges will certainly include managing athlete and spectator movement and safety. They will include dealing with threats posed by natural disasters or even terrorist threats. And I know you'll work to address these challenges to make sure that the games are successful and that people with disabilities, whether athletes, staff, or spectators, are safe and cared for. And the things that you'll be thinking about, I know, are that evacuation, for example, becomes more complex when you consider the additional numbers of people with disabilities in the stadiums. And you consider moving people using wheelchairs, people with visual disabilities, people who are deaf, and people with cognitive disabilities who have trouble following instructions out of crowded stadiums. You'll need to be thinking about emergency alerts and warnings and making sure that they're accessible for everyone, people who are blind, people who are deaf. You'll be needing to think about your transportation system and making sure that's accessible for wheelchair users, for people who are blind, for people who are deaf, and that you have the systems in place to move people safely and effectively from the stadiums to the venues to the spectator areas. And in the event that athletes and others need to be sheltered, choosing accessible facilities or building accessible shelters that can accommodate people with a variety of needs is going to be crucial. These games present such a unique opportunity to put all of these lessons into play, to engage disability stakeholders and government officials to ensure an integrated, inclusive, and accessible games experience for everyone. I know how committed Japan is to its citizens with disabilities. I know that Japan ratified the UN Convention on the Rights of People with Disabilities in 2014. And I also know that you have a law similar to our Americans with Disabilities Act in your fundamental law for disabled persons. So it's clear that the foundation has been laid for the Paralympic Games to serve as a catalyst to support the independence and social participation of Japanese citizens with disabilities. The Games can provide a unique and really once in a lifetime platform to show the world what Japan is doing to ensure people with disabilities are integrated into the fabric of your society, including, of course, in emergency preparedness, response, and recovery. And when the games take place, I will be watching on TV and cheering, and I hope that the lessons learned will serve Japan's emergency management professionals well when it comes to addressing the needs of people with disabilities in the games. Next slide, please. So we've talked about government's roles and responsibilities for emergency preparedness and response when it comes to people with disabilities. We've talked about the collaboration and coordination that's necessary with disability stakeholders and others. But what we haven't yet talked about is the role and responsibility that each individual has for their own preparedness. When a disaster strikes, we may not get help for several days or even longer. So we have to be able to anticipate and plan for our own individual needs to get through the immediate aftermath of a disaster. Less than a month ago, just as your country was observing the 10-year anniversary of the Great Eastern Japan earthquake that was mentioned previously, I know you experienced another series of earthquakes in the Northeast. So I know that you're aware of how important it is that every individual and family takes the steps they need to do in order to be prepared for emergencies and disasters. At Fema, we have a great online resource to help with this, and it's called ready.gov. There's specific information there tailored to people with disabilities as well at ready.gov/disabilities. And on this site, you'll find 3 key things that people with disabilities need to keep in mind when it comes to individual preparedness. First is to get and stay informed. Second is to make a plan. And third is to build a kit. So first, staying informed. Staying informed about disasters by signing up for and paying attention to emergency alert systems is vital for people with disabilities. Emergency alerts, whether on TV, radio, or text, provide life-saving information on the need to evacuate, shelter locations, or perhaps the need to shelter in place. They may help identify whether public transportation is operating or the conditions of roads and other infrastructure. A battery operated radio can be a useful tool to help you stay informed in disasters, but that doesn't help all people. For example, our colleagues who are deaf. So for people who are deaf, ready.gov recommends that people make sure their devices are always charged and they have backup power available so that they can receive text alerts on their devices during disasters and emergencies. Staying informed also means educating yourself on the kinds of disasters you might face in your community. You'll plan and prepare differently, for example, if you live in a place that gets earthquakes versus you will in a place that gets hurricanes or tornadoes or wildfires. So it's very important to know what the risks are in the area where you live so that you know how to better plan and prepare yourself and your family. So the second thing you need to do once you think about how you're going to get informed is to make a plan. So planning, as we've been talking about a lot already all morning, is necessary for successful recovery from disaster. But in the individual sense, planning means something kind of different. What it means here is sitting down with your family or members of your household and identifying what you'll need to take care of yourselves for several days after a disaster strikes. It means figuring out how you'll communicate with family members if a disaster hits when you're not all at home together. It means practicing how to exit your home during an emergency. And it means keeping things like your smoke detector or carbon monoxide detectors working and checking those batteries on a regular basis. Other things that you need to think about when you're thinking about making your plan is creating a support network. So this can be your family, it can be friends, it can be coworkers, it can be neighbors, anybody who can help you meet your particular needs during an emergency and disaster. And you, as a person with a disability, can also be part of someone else's support network, right? You also, as a person with a disability, want to be able to explain to first responders that you'll need to evacuate and how they can best help you to move yourself, move your equipment or devices, or your service animal if you have one. Another piece of your advanced planning is going to be to think about accessible transportation that you may need for evacuation or getting to a shelter. And whether you have a car or access to transportation, are you near a bus or do you use paratransit? And what are you going to do if each of those things or any one of those things is not working? You want to have regular conversations with your support network about where you keep your emergency supplies, how to operate your devices, how to operate your wheelchairs if you use them, right? And you may want to consider giving one or more members of your support network a key to your home or apartment so that they are better able to get in and assist you should they need to in a disaster. Another thing, that comes up quite often is whether people with disabilities ought to register with their local government for assistance. So in the US, for example, many local governments emergency management offices may keep a voluntary registry of people with disabilities so that they can be helped quickly in a sudden disaster. So people with disabilities and their families can look to register with those offices if their town has one. For people who are dependent on dialysis or other life-sustaining treatments, you're going to want to know the locations and availabilities of more than one facility so that you can continue to receive your treatment. Or if you can't get out of your house, what are you going to be able to do at home to continue to receive the treatment that you need? If you use medical equipment in your home that requires electricity, you've also got some planning to do. You have to plan for how you can use that during a power outage. So you may want to reach out to your power company and talk with them about making sure that your power doesn't get cut off, or it is set for priority to be restored in the event of a disaster, because you need that equipment for life sustainment. If you have a communication disability, you have some other things to think about. Like, for example, that your emergency information provides information to first responders on how best to communicate with you. If you use augmentative communication devices or other assistive technologies, think about how you're going to evacuate with those devices and how you'll replace them if they're damaged or destroyed. And you have to plan for how you'll communicate with people in a low-tech or no technology way if that equipment is damaged or destroyed. For families that have children with disabilities, they may have some unique needs as well that you have to consider. So make sure that you're including the needs of children with disabilities in your planning. And don't forget pets and service animals. They're members of your family and your household too. And you're going to need to think about what you're going to do with and for them in the event of a disaster. So these are a lot of the pieces that go into thinking about making that plan that's going to help individuals and families better prepare for disasters. So once you've gotten informed or figured out how you're going to stay informed and you've made your plan, now it's time to think about building your kit. And a kit is unique to an individual or family, and it should include everything that you need in it to sustain yourself and your family for several days, really, if you're sheltering in place at home, or if you have to evacuate to a shelter or somewhere else. And now I understand that in Japan, many of your households do have emergency kits with things like food and water and other essentials. And this is a great start. And so what I'd like to discuss are some ideas that people with disabilities in particular might consider adding to that basic kit. So everyone, of course, needs food and water, but some people with particular disabilities like diabetes, for example, may need a special diet. So you're going to have to think about adding that kind of thing into your kit, right? In addition to basic survival supplies, a kit should really be focused on meeting your individual needs. And you, as a person with a disability, as a family member of a person with a disability, you are best positioned to understand and identify what those needs are and to figure out what the items are that you're going to need in your kit to help you sustain your health and safety for those several days that you may be waiting for assistance. So for example, if you or a family member are deaf or hard of hearing, you may want to have a weather radio with a text display or flashing alert or both, extra hearing aid batteries if you use them, and a pen and paper. Remember what I said a few minutes ago about going low tech or no tech in case technology fails you? We all have to think about those kind of backup plans if our technology fails us. So for people who are blind or perhaps have low vision, if you use Braille, you may want to mark your emergency supplies with Braille or large print if you use that. You may want to have an extra cane if you use one. You may want to include some magnifying devices if you use those in your kit. For people with speech disabilities, if you use augmentative communication devices or other assistive technologies, again, think about how you'll evacuate with those and plan how you'll communicate with other people if that equipment fails you, if it's damaged, destroyed, or not working. What is your low or no technology way that you're going to communicate with people? For people with mobility disabilities, if you use a power wheelchair, make sure you have a backup battery and that it's charged or you have the ability to charge it. If possible, have a lightweight manual chair as a backup too. Show your support network and others how to operate your wheelchair. You might keep a patch kit or a compressor or tire pump in case you get flat tires. If you use a cane or a walker, you may want to consider having an extra one as a backup. Or if you use a seat cushion on a wheelchair or other device, you may want to have an extra. So again, it's thinking about what you're going to need to stay safe, to stay healthy, to stay mobile for maybe several days during the event of a disaster. And you don't want to be in a situation where you're evacuated without your devices, and really that completely erases your ability to be independent. That is why planning and building a kit is so important. And so for people with autism or sensory difficulties, handheld electronic devices and headphones are lifesavers with movies, games, social apps, all of those kind of things to provide quiet distraction and to avoid having to engage with crowds and noises can be really useful. And then for people with all types of disabilities, you're going to want to think about at least a week-long supply of prescriptions, a list of all your medications and dosages, maybe extra eyeglasses if you wear glasses or contacts, oxygen supplies if you use oxygen concentrators or things like that, information on any medical devices that you use and insurance information, copies of your medical insurance, copies of your identification, your driver's license or state ID or whatever sort of identification you have. Contact information for your doctors and your therapists or healthcare providers, and also contact information for any emergency contacts that you may have that you may need to reach in the event that you're separated in a disaster. And then again, thinking back to what we said about planning for your pets and service animals, thinking about food and water and medical records and supplies for your pets or service animals. And finally, one of the most important things that I think you might want to think about for your kit is getting some cash money for your kit. If power goes down, you may not be able to access an ATM. You may not be able to get to your bank. Roads may be impassable. Transportation may not be available. So, and I know for some people with disabilities, this can be quite challenging when people are on a fixed or limited income. But if you can manage to stockpile a little bit of cash every week or every month and keep that in your kit so that you have some ready cash to take care of your basic needs if a disaster hits, I think you'll find that you're in a much better place. So all of these things can really help people with disabilities and their families to go a long way toward ensuring their successful recovery in the event of a disaster or emergency. Next slide, please. So we've talked about federal interagency coordination. We've talked about local and state responsibilities, individual preparedness, and the Paralympic Games. We've talked about the importance of integrating the needs of people with disabilities across all facets of preparedness, response, and recovery. And all of these factors came into play in FEMA's COVID-19 response. We began with helping states with COVID testing sites, and now we've been involved with the Vaccine Center mission, making sure that everyone who wants a vaccine can get one, including people with disabilities. In this effort, we've had regional disability integration specialists and disability integration advisors working across the nation to ensure that people with disabilities could get vaccinated in a safe and accessible way, including things like creating an expedited guest process to ensure that people with autism or other disabilities that made waiting or following directions difficult ensured that they could be guided through the vaccine centers quickly and efficiently and get their vaccine and get out. They were involved in creating sensory rooms for people who needed quiet space prior to or after receiving their vaccine. They were involved in getting dedicated drive-through lanes for paratransit vehicles and providing in-vehicle vaccination when it was requested. They were involved in providing American Sign Language interpreters, both in person or via video remote interpreting. Also facilitating vaccine events at a lot of different community locations like centers for independent living, schools for blind individuals, schools for deaf individuals, events that were hosted specifically for people who are deaf in the community and had ASL interpreters. And also they worked very hard to identify locations where the mobile vaccine units should go, where they would do the most good and where they would reach the most people with disabilities and others who needed that access. They also were really instrumental in ensuring that as facilities were built up, that they were made accessible for people with disabilities with parking, close proximity to public transportation, and overall accessibility of those vaccine facilities for people with all different types of disabilities. So through all of these efforts across the nation, we were instrumental in ensuring that people with disabilities could access the vaccine in an effective and efficient and really comfortable way. And I think that's really important because for a lot of people, this was kind of a scary thing and it's kind of an unknown thing and people are unsure about it and they're a little nervous about it. And so the regional disability integration specialists and disability integration advisors were really an instrumental part of this team providing this service in the communities, helping people with disabilities to, who made that choice to get the vaccine, to be able to have a comfortable and safe experience. So I'm really proud of those efforts and, the numerous people that we were able to help people with disabilities get a vaccination. So, and of course, this mission is ongoing in, all across the nation and all across the world. And we continue to see more and more people with disabilities getting vaccinated and their families and hopefully returning to school and work and sort of, more normal home life as a result. So we're really proud to have been a part of that effort. So next slide, thank you. So finally, individual preparedness, local, state, and regional coordination, federal interagency collaboration, and engagement with disability stakeholders is vital to successfully integrating the needs of people with disabilities, right, into emergency preparedness, response, and recovery. And it's only through this working together. Remember, I said we can't do it alone. It's only through working together that we can truly help people with disabilities before, during, and after disasters. So I'd like to thank you so much for having me with you this morning, and thank you for your time. And now I look forward to taking some questions. Thank you.
Thank you very much, Linda. It was a very impressive discussion and presentation. In Japan, we are yet to have a comprehensive system for people with disabilities. So I believe that the audience was very much excited listening to your presentation. And nearly half the audience did not know very much about Fema. Also, only 60% reply that there is a regional disaster preparedness plans, but many people answer that they are not quite sure whether there is any specific component targeting people with disabilities. So these are the people tuning in this morning. Now, let me give you some questions.
Mhm.
First, about the disability coordinator. Are these coordinators people with disabilities? And how do they get qualifications, and who pay for this education to become certified as one? And I think that this question is reflective of the fact that many people are earning to become one. And I believe, Linda, that you are really a shining role model for people with or without disabilities. So tell me about the certificate or the qualifications or the kind of education that they need to receive, and what kind of employment is it? Are they a public servant or are they a freelancer in the private market? So these are the questions that we have received. And there is another similar question. Director of Disability Policy has been newly installed in White House. And what kind of person is this director? So these are the questions that I would first like to ask.
Great. Okay. So the regional disability integration specialists they have varied backgrounds, from emergency management to social work to disability case management to disability law, of a variety of backgrounds. And I think what draws people to the position is really the opportunity to make a difference in the life of people with disabilities. The regional disability integration specialists are full-time employees, and primarily the background and experience that is needed is an understanding of the issues facing people with disabilities and some experience in that. Emergency management experience is also very helpful, but not necessarily the top priority. An ability to speak in public, to train and educate and conduct outreach. These are all very important skills as well. And so again, there's not one specific background that people come from to do the work. I think it's really that people get very interested in the mission and the vision and the reason behind Fema existing and the reason behind the Office of Disability Integration and Coordination existing. The disability integration advisors that I mentioned, those individuals are not permanent full-time employees. They have a different qualification set. While they may come from similar backgrounds as the regional disability integration specialists, whether with case management, social work, law, counseling, all of these various backgrounds, they are people who are sent out to active disasters. And so they are primarily out in the field responding to disasters, not in an office. And they become qualified for those positions through completion of what's called a position task book, by completing particular tasks and trainings when they're deployed. But again, the background that brings them to that position is very much similar to that of the regional disability integration specialist. And then finally, the disability policy director in the White House, she has an extensive background in disability, first as a special education teacher, and then working on Capitol Hill on disability policy issues in a variety of topics. And then she was hired from her work in disability policy specifically to come to the White House and lead this cross-agency initiative. And it's really very exciting. It's the first time we've had it. And I think it's going to result in a much more coordinated effort to serve people with disabilities across all the federal programs.
Thank you very much. We were understood very well. So let's move on to the next question. In the case of Japan, those people with disabilities, depending on the type of disabilities, they are provided with the disabilities passbook, but we don't have such thing in the United States. If that is the case, how do you, how do I say, identify or find those people with disabilities? And if they're in facilities, I think it's easy to tell. But if they're at home or in communities, how can you find those people and understand their needs so that you can provide support?
Excellent, excellent question. So there is no one centralized way in the United States of identifying people with disabilities. There may be people with disabilities register for assistance with Social Security or Housing and Urban Development for an accessible housing unit. So there may be ways when people sign up for particular government services or programs that they're identified as an individual with a disability. But I think what's more common is that at the local community level, people with disabilities are often engaged with or receiving services from a nonprofit or a non-governmental organization like a Center for Independent Living. And those organizations have a much better understanding of the population of people with disabilities in the community because they're working with them on a regular basis, on a daily basis. And so that's one of the ways that people with disabilities can be identified. We talked earlier about these emergency management registries that some towns may have. And so people with disabilities can voluntarily agree to provide their information to the emergency management agency and indicate that they'll need assistance in the event of a disaster. And while there's benefits to this idea, but there's also challenges with it because the individual with a disability registers their home address, but that doesn't mean that if a disaster strikes, they're actually at home, right? They might be at work or at school or shopping or at a friend's house or something else. And so it's a challenging system as well. And so because we have, many different layers of federal, state, and local kind of coordination, there's a lot of different places where we can where we can identify people with disabilities, where we can get the data about people with disabilities. So it becomes a matter of really coordinating it in the most effective way. And really, and most often, quite honestly, it's at that most local level because that's where disaster response happens, right? At the local level. So the local organizations, the local emergency managers, the better knowledge of and understanding of the community of people with disabilities there are in their area, the better able they are to serve them. I hope that helps answer that question.
Thank you very much. We have received so many questions, so let's go to the next question quick. For emergency situations, every person can be vulnerable. However, the most vulnerable and helpless are the people with disabilities. And elderly citizens. As you have pointed out, preparedness before, during, and after the disaster. And the entire journey of this before, during, and after is being supported by FEMA. But at the very end phase, when is the timing of the end of FEMA support after a given disaster? That's the question.
Thank you for that question. So FEMA provides assistance in federally declared disasters. So there are many disasters that are handled at the state or local level that FEMA doesn't get involved in at all. But if FEMA is providing support to a state or a territory or a tribal nation that's been impacted by a disaster, they're going to provide two types of assistance. There's what's called individual assistance, which is helping to replace personal property that's damaged, repair damaged homes, help people with temporary housing, medical needs caused by the disaster, things like that. These types of assistance basically are going to probably go as long as maximally 18 months. For example, in the instance of temporary housing, the most someone will receive is 18 months, unless there's extreme circumstances and there's an agreement to extend that service, right? But what has to happen is, what I've talked about, the interagency coordination, the involvement of the non-governmental organizations and the community organizations. So they're really providing services kind of all along the way while FEMA is helping people respond to and take those first steps toward recovery. It's really the community organizations that are going to provide the longer term services once FEMA's assistance has ended, and to work to reintegrate people into the community.
Thank you very much.
Mm-hmm.
As part of the support from FEMA, when you provide individual support, people with disability may not be the only one. I mean, their families are probably providing the care. In Japan or US, I think this situation is same. In those cases, for families who's providing care to people with disabilities, is there any measures from FEMA to support those family members?
Yeah, that's a really good question. So, when there's a family member with a disability in a household that's impacted by a disaster, all of the people in that household are eligible for the assistance of FEMA. So they would be eligible for their personal property, expenditures. They would be eligible for that repair and replacement to the home or temporary housing assistance and things like that. In the situation of somebody with a disability who is in temporary housing or in a shelter, there's also the possibility that personal assistance services could be provided to that individual. And I think that may address a little bit of the question, because I think they're talking about individuals with disabilities kind of receiving that personal level of care from the family. And so there may, in certain circumstances, personal assistance services can be provided, which I think would relieve some of that caretaking that the family is doing.
はい、ありがとうございました。
Thank you. We are receiving so many questions, and I'm afraid that we may not be able to entertain all the questions at this time, but let me move on to the next question.
Mhm.
Be it in Japan or in the United States, we have evacuation drills.
Mhm.
In Japan, for example, we have local disaster evacuation drills, but we seldom see people with disabilities joining such drills. So in the United States, in these drills, do you carry out integrative, inclusive evacuation drills, and how do you carry it out?
Yeah. So one of the things that my office does is to work with our exercise division to ensure that the needs of people with disabilities are included into exercises and drills. And so that information then is shared with state and local government jurisdictions to encourage them to include people with disabilities into those drills and exercises. And that goes back to what I mentioned before about the need to develop those relationships and to collaborate early, so that if the emergency managers are familiar with the organizations serving people with disabilities in the community, they can actually identify people with disabilities who could participate in those drills and exercises.
Mm. そうですか。はい、ありがとうございました。そういたしましたら、
Thank you very much. Let's move on to the next question.
Mhm.
I think this is the perfect question for today's video lecture. In 2021, in the Great Eastern Japan earthquake, there were areas that were hit, places that were hit by the earthquake, and question comes from the person who was hit. So this person suffered tsunami disaster in Rikuzen Takada City. And inclusion and accessibility, the philosophy of Fema, as you just mentioned, these vision or philosophy has been kept over the past 10 years. And I mean, they are also keeping the same philosophy or vision, and they have been trying to reconstruct the region. And Rikuzen Takada City would like to is hoping that the government will intervene in order to help them reconstruct. In Japan, there is no such thing as a Fema, an organization that serves the same role, but they think they need it. But what do you think about this? Do you think that Japan should establish an organization like Fema? Of course, this is not an easy question to answer, but we would like to hear your views.
Thank you for that. That is a challenging question to answer because, you know, every nation operates differently and governments are set up differently. But if you'll recall what I said at the beginning is that FEMA's philosophy is really that the best place for disaster to be managed is at the local level. So really where the most emphasis on disaster preparedness, response, and recovery should be placed, I think, is at the local level. And that capacity building needs to happen at the local level in order to improve towns and cities and all of that ability to prepare for and respond to disasters. You know, I think the US may be unique in having FEMA, you know, and having that national level coordinating body. And I think that is the unique role that FEMA can play, or an organization like FEMA to be a coordinator, right? And kind of an overseer. And I think that is an important role, but it may not work everywhere.
Hi, ありがとうございました。
Thank you. America is a country of diversity, and also it is a very inclusive driven country, which proves a strength in responding to disasters. In cases of disasters, people with disasters also have to be independent and self-determinant as well, as you have rightly pointed out. In the meantime, people with disabilities may have different types of disabilities, and the degree of disability may vary. Depending on the types and degree of disabilities, individual responsibility may vary as well. And I would like to have your comment on that aspect. Thank you.
Sure. And that's an excellent point. Two people with the same disability are certainly not impacted in the same way and don't have the same level of function or ability or resources either, quite honestly. And so every individual is an individual. And so the things that we talked about here tonight really are guidance and guidelines and ideas, right? But it really very much comes down to the individual knowing themselves and what they need and being able to be self-determinative and being able to identify what they need, or if they need support to identify what they need, right? Some people need that assistance as well. But the best that we can do is provide frameworks and guidance for the most people, recognizing that each of us is an individual and each of us has individual needs, and really we're best placed to know what those needs are.
Thank you very much. We are receiving lots more questions. So we'd like to cover them, but unfortunately, we're running out of time. We would be grateful if we had, 1 more hour to go, because we would be able to deep dive on this topic. But unfortunately, we need to stop here. So we have 1 more minute. Would you give us your closing remark, or just what your impression about this webinar is?
Sure. So I'm really pleased to have been here with everyone this morning, and I wish we did have more time to have a continued conversation and to answer all your questions. And I would certainly welcome the opportunity to come back and do just that. So I think that the discussion is very important. This topic is very important. Preparing people with disabilities for emergencies and disasters will continue to be a priority for me, for the United States, for our administration. And it's only going to be more important over time as the number of people with disabilities continues to grow. But I really appreciate the opportunity to be here with all of you, to share some ideas, to hear from you. And I really look forward to continuing our conversation and welcome anyone to reach out at any time if I can provide any assistance. Thank you again for this wonderful opportunity.
本当にどうもありがとうございました。とても意義のある講演会でした。どうもあ
Thank
り
you
が
very
とう。
much. We had a very meaningful session today. Thank you very much. With this, we would like to conclude. We should have a big round of applause from the floor, but unfortunately, it's not the case. But now we would like to conclude. Thank you.
Thank you all so much for joining us today and for your great questions. We did note that there were quite a few questions that were asking for more information about FEMA or useful links that our audience can explore. So we will be sending out that information after the program. And before we end today's program, we'd like to invite our audience to take a short events survey. So you will shortly see a QR code pop up on your screen. while you take a moment to answer that, I would like to thank our keynote speaker, Linda Mastandrea, for joining us today and for sharing your wonderful expertise and personal experiences as a Paralympian with us. Thank you as well to Professor Kitagawa for your expert moderation and stewardship of the event. And our special thanks to our simultaneous interpreters and technicians at NHK, our Japanese Sign Language interpreters at the Okinawa Prefecture Welfare Association for People with Disabilities, and to our captioners at UD Talk. We're grateful for your support for today's program. Lastly, I'd like to invite you all to visit our website or social media for further information on upcoming events and programs promoting greater diversity and inclusion. To do so, it takes all of us, so we invite you to join us in that conversation. We hope to see you at one of these events soon. Thank you all so much for joining us today, and we hope that you continue to remain safe and healthy during these times. Thank you again, and take care.